Good morning, good afternoon, good evening, everyone. Welcome to this LinkedIn Live on a topic which is how technology can impact $30 billion revenue cycle management spend. Before we get into the meat of the discussion, let me quickly introduce myself and my co-panelist. So my name is Ankur Verma. I am a vice president at Everest Group, and I lead the research in the areas of healthcare and life sciences. So I work with health systems, I work with the outsourcing service providers, I work with technology companies and other partner stakeholders who have a stake in the revenue cycle management industry. With me, I have my co-panelist Priya Sani, who is a practice director at Everest Group and who is currently leading a lot of research engagements in this area. Priya, would you quickly want to introduce yourself?
Sure. Thanks, Ankur. So, my name is Priya Sahani, and I'm a practice director with the firm focused on the RCM market as well as the broader healthcare practice. Um, uh, yeah, that would be it.
Thank you, Priya. So before we get into the discussion, I would also want to request all the attendees to let us know from where you are joining from, as well as any questions that you have which you would want us to pick up during the discussion. We want to keep it a two-way discussion. So feel free to share your thoughts, observations, questions, starting with where you all are joining from. With that, so Priya, let me start with the basics, which is why is technology a topic worth discussing when it comes to revenue cycle management, right? So could you talk about maybe some of the challenges that different stakeholders in the industry are facing because of which you, I, Everest Group, and a lot of our clients believe that the time for technology adoption has come in revenue cycle management?
Sure, Ankur. So, I'll talk about some of the things that are continuously coming up in our interactions with the health system. So, if you think about the margins or the overall cost that a healthcare provider today incurs, a lot of them are not really making great margins or are sitting on really thin margins. Also, they are not sophisticated enough compared to the payers to be able to respond to the claims denials and understand how a lot of it needs to be administered. Ultimately, what we see happening in the healthcare provider market is that a lot of money is still being spent on administrative side of things. There are a lot of claims still denied. The AR days are increasing multifold. And what all of it ultimately means is that the healthcare providers whose core job is to look after the health of the patients, they are not really able to do that well because of all of these administrative related things and things around cost, which are taking up a lot of their mind share. We'll delve a lot deeper into, as we continue with this discussion. But this is a very, very high level overview of some of the challenges that healthcare providers are talking about. I'd like to specifically highlight one more challenge here, which probably we might not have talked about, say, 5 years back, but has become, if not the most important, one of the most important topics now, which is patient experience. When all of these things are taking a center stage, what it also means is the experience that a patient really desires, they're not able to get it. And we all know how patients are expecting healthcare to provide them with the kind of experience that retail or BF banking and financial services industries can provide them. So this is just some of the challenges that health systems and even the patients keep talking about, and most importantly the physicians keep highlighting. We'll as we progress in the discussion today, we'll talk about wherein technology really comes into play, and how we see the health systems navigating through some of these technologies.
Sure. And I think, Priya, your point around patient experience being the center fulcrum of what healthcare providers really struggling with, I think that's spot on. And I can share my own experience, right? So my own experience of dealing with the US healthcare system. So recently I booked my appointment for the annual physical checkup. And I'm somebody who likes to use these portals and the applications that payers and providers have. So when I was booking this appointment, I tried using the portal and the application of my insurance company and my primary care physician provider. And strangely, I was not able to book appointment using that, right? Not only that, I had to call the PCP provider at least a couple of times to book that appointment. Now that's on the front end. When I actually went in for the annual physical checkup, my understanding was that everything, uh, every service that I avail in the facility would be covered under my insurance. However, that was not the case, and I was not aware of the fact that there would be certain processes which would be out of pocket for me, right? And there was no intimation from either the healthcare provider or from the insurance company regarding that. Now that's with what happened within the facility. Now, when I uh, so after I checked out of the facility, after 2 weeks, I got a bill of certain number of dollars, which was again shocking for me because, as I said, there was no intimation from either the healthcare provider or insurance company on that. So again, just an example of how your point around patient experience being the fulcrum of uh, some of the challenges which healthcare providers are facing and how technology can really impact some of these challenges in the industry. So, Priya, moving on to my next question, which is now when it comes to technology adoption, it's something which we are talking about since the last 4 to 5 years, right? So, what do you think has really changed in the last 2 to 3 years because of which you believe that it's an area or technology adoption is really the focus of healthcare providers right now?
Yeah, I think that's a very valid point that, why were we not doing it, say, 5 years back, and why are we really talking about it so much now? And more important than talking, are we really seeing adoption happening now? But before I answer this, Ankur, I'd like to highlight the point that you were talking about your experience in a hospital. I think that's very reflective of what most of the patients are seeing these days. So probably, patients who've already been to a healthcare facility n number of times, they're still visiting a hospital and entering all basic records about themselves and entering the basic information. So even some of the very fairly basic information or automation around, patient scheduling or filling in the basic information of a patient are not something that every health system has been able to solve for. So definitely the patient experience or access part is something that needs a lot of focus from the health systems as of now. I'll jump into what is really changing now. Why do we really see adoption happening now versus say a couple of years back? So if you think about the healthcare providers, they were already sitting on the edge. But probably what COVID-19 did was push them, ahead with a kind of disruption that it caused. And what it meant was that there were already a lot of inefficiencies in the systems, but because of the elective surgeries going down, the number of patients increasing, the margins were again severely impacted, and the operational efficiencies, the operational efficiencies uh, or the inefficiencies really got highlighted more. What it kind of made healthcare providers aware was that it had become extremely important for them to use some kind of technology in say claims scrubbing, medical coding, or claims management side of the ecosystem, to be actually able to focus more on things that require more of their attention, which is care for the patients, and more importantly reduce the spend that is going in all of these administrative tasks. We've all heard of the a lot of physicians actually closing down during COVID because of the costs really soaring up for them and them not being able to balance their balance sheets. So now probably even for the larger health systems, managing their AR days has become very crucial. So COVID definitely brought in that nudge where a lot of the providers understood how they really need to now adopt technology to plug in the administrative inefficiencies that exist in their systems. And probably one good thing that COVID has done was accelerate the digital adoption. So, and this is something that has happened across industries, including healthcare. And luckily, RCM is also an area which is seen or tried to benefit some bit from this digital adoption. So, what we've seen is more adoption of advanced analytics, AI based systems across the value chain to test some of those use cases, which probably were not even getting tested, say, a couple of years back. So those are some of the changes that have happened in the last couple of years. Before before we move ahead, I also have a question for the audience, which is around that when it comes to when it comes to patient access, are this what is the most pressing issue according to you that you've seen most of the patients endure while visiting some of these health systems?
And Priya, I'll share an example of a conversation or a client, I would say, which is a long-standing healthcare provider client of ours, right? So a couple of years back, we started discussions with this particular client, and the problem statement was that I am facing financial pressure. Uh, I have 800 agents for my patient engagement, including scheduling, eligibility verification, pre-authorization. However, there is so much attrition within those 800 agents that I'm not able to handle the inquiries that I'm receiving from my patients, right? So we had multiple conversations with this particular client. We talked about potential solutions, including also diversifying delivery from offshore, but that comes with its own set of challenges, right? So one of the solutions that we discussed with this particular client was adoption of technology and specifically those self-service tools. Because what we have seen in many cases that these portals or tools can significantly reduce the dependence of health systems on manual agents, right? Now, through those series of conversations, we help this client in identifying the right partner who can provide such a solution for it. And you'll be glad to know that this particular health system client was able to reduce the number of agents for patient engagement by 30% in the last 2 years using the implementation of such a solution, right? So just one example of, you talked about how COVID really changed things. It really did. And that also, at an exponential rate.
Yeah, no, I completely agree, Ankur. And I think you highlighted a very important part of, how the number of people, they were able to reduce the dependency on the number of people. But I'd also like to highlight a couple of more aspects here. So if you really thinks about the denials part of the ecosystem, there are a lot of denials that are manually just very, very difficult to understand, and before the claims are submitted or even after the claims are denied by a healthcare payer. So again, I'll go back to my earlier example that most health systems are not sophisticated enough as the payers are today in identifying or managing those claims. And what it ultimately seems means is that there are two parts to it. One is if there are simple discrepancies that are done on the medical coding side of things, simply because the number of claims that have to be submitted are really huge. And a lot of manual dependency means that there are still a lot of very easily preventable errors that are happening in the ecosystem. Uh, Probably one of the other problems that was also there in the ecosystem was that the existing medical coding softwares, they were only adopted by some of the larger providers simply because of reasons like related to costs, etc. And most of the mid-sized health systems were still doing a lot of these things manually. Now we are seeing not just more medical coding softwares coming into the ecosystem, but a lot of these mid-sized providers also up exploring it, which is bringing down their cost in terms of the point you were highlighting, Ankur, the number of people who are working on, say, specific numbers of claims, but also the denials have significantly reduced. So there are health systems who are telling us that because of usage of these medical coding softwares, there is approximately 20% of the spend going down in terms of the very easily identifiable denials. And then if you look at the claims denial side of the ecosystem, there are a lot more there's a lot more sophisticated technology that is being leveraged now, which ultimately again means that your providers are able to understand the root cause of some of these denials, not just address them for this particular claim, uh, but also make sure that those things are not done for the future claims, which bring down the cost. And a lot of the providers who've been exploring some of this have been able to leverage cost efficiencies from say 20 to 40%, depending on the technology that they are using. So I think we are seeing a lot of these good examples coming up in the last couple of years, which is earlier it was just something that was adopted by the large size providers, but now even the mid-sized ones are begin to adopt a lot of it.
Absolutely, Priya. And I think we cover some of these technology solutions and also the suppliers or service providers who offer those solutions extensively in our research. Uh, I, uh, in fact, there are many reports that we have published in this area, and one of those reports is, of course, a recently published peak matrix report on service providers who offer services combined with technologies for for health systems in the US when it comes to revenue cycle management space, right? And I think that's a report. So we have a complimentary copy of that report, which we'll be happy to share after this event. And yes, if anyone has questions on those technologies, those solutions, and those service providers, feel free to reach out to us, and we'll be happy to get on a call and discuss. So Priya, so we talked about the challenges. We also talked about what changed in the last couple of years. Let's also focus on which are the areas where you think uh, these technologies are being really implemented in the revenue cycle management, right? So you have patient engagement at the front, then you have medical coding and billing at the mid cycle, and then you also have denials and AR management at the back end. So which are the areas where you have seen, based on your conversations with the health system clients, they being more open towards adoption of some of these technologies?
Yeah, I think that's a very important question, Ankur, to be answered today. Probably what we are seeing is that medical coding is an area where most of the healthcare providers. So if you think about the spending in from these buy side or the enterprise side, probably we see maximum spending still happening on the medical coding side of the ecosystem, because it can be directly tied to impact in terms of lesser denials, cost better cost efficiencies being explored. And that's a welcome trend in terms of we would really want to move towards a system where the medical coding side of the equation is completely automated and there is very less dependency on manual coders. Probably some of the area claims denials is probably another area where we are seeing technology being explored, but probably the challenge that we see is that there needs the AI or analytics needs to be continuously deployed to a system in order for it to become more effective and realize those and do that root cause analysis. We see some kind of a hesitation at times from health systems to be able to wait for some time to be actually able to enjoy the merits of some of this technology. But probably claims denials is another area where we are seeing now better push. I'll not say the stages it's still being adopted to the extent we would have preferred, but probably the adoption is increasing in that particular area. What I'd like to highlight here is what an area where we still see a lot more innovation that is possible is the patient access side of the ecosystem. And again, the things that we were talking about. So probably one thing that takes a backseat within healthcare is the patient and the physician experience, and hence simple things like being transparent in terms of the out of pocket costs, or making sure that prior authorizations are 100% electronic and there is no manual intervention, or there are at least very less manual intervention needed. Those are areas where there is still a lot more potential for adoption of this technology. Even within claims management, what we are seeing is that the claims after they are submitted and they are already declined is where more technology gets adopted. Probably we would want to shift to a system where claims scrubber become the central point, and there are very less claims that they are even after getting passed through the claims scrubber are getting denied. So those are possibly some of the things we want to move towards. And healthcare systems, because of different challenges that we'll just talk about in some time, for now are still exploring and I'm not adopting it to the extent that some of the other industries have been able to adopt. For example, we were talking to a health system recently, and what they highlighted was that the medical coding software that they are very hesitant. They are still relying on people or people to actually do that coding, even after being offered automation solutions by by the service provider or their vendor. They're not really open to exploring a lot of these technology solutions. Reason being, firstly, there is just an inherent bias towards using technology. They don't feel as comfortable in using technology. And secondly, realizing the fact that it will take at least 6 to 12 months for those softwares also to completely train for their particular health systems is not something they are very comfortable with. So hence I think that change management journey is something that the providers are specifically very reluctant towards, and the owners really relies on the technology vendors or the service providers to educate them and make the journey more smooth in terms of making sure that technology can be adopted more freely.
Sure, sure. Thanks, Priya. And I think we can also let's also ask this question to our audience. Uh, so please highlight areas where you are seeing adoption of technology in the revenue cycle management value chain. As Priya highlighted for us, I think some of the areas where we are having conversations include medical coding, where a lot of conversations are centered around the implementation of computer assisted coding solutions. A lot of conversations are also happening around pre-authorization, right? So if you look at the industry, at least a quarter of pre-authorizations are still manual, and those take a lot of time for the medical professionals to spend time on, right? So that's another area where we are increasingly seeing a lot of interest within health systems to look for technology solutions, right? I'll also give a couple of examples of health systems who recently embarked on technology journey with respect to a couple of areas, right? So the first example is of a health system called Hackensack Meridian Health. Now, when we talk about collections, patient collections, so 90% of the collections in the industry is still manual, and that takes a lot of time of healthcare providers, right? So this particular health system, Hackensack Meridian Health, it adopted a patient collection automation solution using which it was able to reduce the uh, manual effort on patient collection by 40%, right? So that's an example of an area where technology adoption is very low, but a couple of health systems have started embarking on the journey to change that, right? Another area where I have seen adoption of technology is patient pay estimation, right? So, as I said, from a patient experience point of view, one of the pain points that a lot of members highlight is that they are not able to really understand the bill that they have to pay if they avail certain services. So there are a lot of health systems who try to have manual resources that typically takes around 15 to 20 minutes of time for one, uh, to create one estimation for an individual patient, right? So that takes up a lot of time for time of health systems, and that's why a lot of health systems are also opting for these patient pay estimation solutions. uh, a good example is a health system called Oceaner Health. So recently, they adopted a patient pay estimation tool from one of the vendors in the industry, and they have been able to significantly reduce the time that their physicians and their nurses were spending on doing these estimations. So again, couple of examples of actual health systems adopting for some of these solutions. Priya, anything else that you would want to add when it comes to areas where we are witnessing technology adoption from health systems?
No, I think Ankur, we probably covered all of it, and I guess the nuance or the meat of it lies in how sophisticated the analytics or the automation can become, and for which the key is, deploying it for months on years, because technology will take its own sweet time to be able to increase its efficiency. So for example, what most of healthcare systems have, when they're sharing their journey, have expressed is that initially when a medical coding software is deployed, the efficiency could be somewhere between 60 to 70 months percent for the first 3 months, and it goes up to as high as 95% if it's deployed for a year. Similarly, for the claims scrubber or the claims denial softwares, the efficiency keeps going on improving. In fact, with very advanced AI, what's also possible is that errors which have never happened in the past, even those errors can be identified if AI becomes sophisticated enough and is fed with enough data. So probably, the meat here or the essence here lies in how technology is leveraged, and healthcare systems actually taking the past to be able to explore some of it, to be able to realize some of those efficiencies.
Sure. Uh, Priya, as we move forward, I think one of the questions that we receive from our health system clients is, okay, there are so many technology solutions available in the market, right? But how do we really overcome the challenges around cost, right? Sometimes a lot of service providers in the industry overpromise things, and then they are not able to deliver those ROI to health systems, right? So, what are some of the inhibitors that you see different stakeholders in the industry face from a technology adoption perspective?
Sure. So, Ankur, while there are a couple of challenges, I'll like to start with probably the most significant ones, which is getting access to or integration with some of the EHRs in the house. So, probably getting in the integrations to the existing EHRs or EMRs that are deployed in house is a challenge that most health systems face today, and the solution vendors need to account for. Apart from it, it's not just the integration with an EHR or an EMR vendor, but it's also the interoperability between the different tools that are being deployed or the different add-on tools. For example, your patient access tools getting integrated with your medical coding tools, which are further integrated with your claims denial software. And in most systems, if it's, say, I leave apart the very large health systems, the different tools that are deployed across all of these areas are always very different, and hence making sure that all of these talk to each other and there's a central database that they can get access to is something that most systems are still struggling with. Apart from it, there is of course the cost aspect that we talked about. The cost aspect around taking that inherent first plunge of adopting a software and then probably waiting for a couple of months to be able to see the ROI from it is not something that all health systems are very comfortable in as of now. So those are some of the challenges that health systems keep talking about. But this is again more from an enterprise point of view. If we talk to the service providers, the biggest challenge that they talk about is change management or convincing the healthcare professionals of even being willing to adopt some of this technology. So probably the different both sides of the ecosystem have completely different challenges that they are talking about, and there is some level of resistance or hesitations to adopt technology in the first place that needs to be overcome. In fact, I'd also like to ask the audience on today that what are the biggest challenges that you are witnessing when it comes to adoption of some of the technologies that we just talked about.
And Priya, there is a very interesting comment that one of the LinkedIn user has shared, which is uh, that BPaaS, using a BPaaS kind of solution can really help, prevent that surprise when it comes to suddenly health systems sharing huge paper bills with patient, right? So as we were speaking earlier, I think that's a very relevant point. One of the biggest pain points that patients have is when they receive huge amount of bills at the end of the when they exit the facility, which they have no idea about, right? So having a BPaaS solution which can send them reminders on uh, the the cost associated with the services that they are availing, I think that can really help improve the patient experience, and that can also help improve the stickiness of that patient with the health system, thereby improving the revenue cycle efficiency of the health system as well, right? So that's a very relevant point that this particular user has talked about.
Yeah, no, I completely, would like to, I would completely agree with this, and especially the transparency. So, in fact, I was having a conversation with another health system, a couple of, in fact, it was not a health system, but one of the physician groups, and our question to them was, what do they think is the biggest inherent challenge when it comes to working with, from a patient perspective? And according to them, the biggest challenge from a patient perspective is the transparency. Health systems are probably, or health systems or physician groups are probably the ones who should be trusted the most, but most patients today do not really trust these health systems or physicians, and there is a inherent lack of transparency in the system, which in a lot of cases is not intentional from the side of these health systems or physicians. And better technology can definitely address some of this, which is, exactly what we were just talking about.
Absolutely, absolutely, Priya. So, Priya, let's also, so we talked about the challenges associated with technology, right? We also talked about the areas where we are having conversations with clients on tech adoption in revenue cycle management. Could you also provide some view of maybe the upcoming vendors or service providers who operate in this field, who are really bringing those innovative solutions which can help health systems across the value chain?
Yes, and Ankur, that's also the precedent to what I would want to talk about. So, recently what we've seen is that so I'll go back to one of the questions that you had for me earlier, which is, where in the value chain do we see maximum adoption of technology? And that's probably on the medical coding and claims denial side of the ecosystem. So we all know about the larger vendors who are operating in this space from a very long time, but what we are seeing is that the mid-sized and the smaller physicians are still reluctant to work with some of these larger vendors given the cost associated with adopting that, and hence now we are seeing a lot of trailblazers come into the ecosystem, which are offering very innovative technology around medical coding or claims denials. And from a health system perspective, there is good adoption that is happening around some of these trailblazers. So what we did was, having understood this client environment, we wanted to understand who are the key players who are bringing forward these technologies or solutions to the ecosystem. And after starting with an initial long list of 70 plus vendors, we shortlisted 7 of these vendors. And probably one thing which is common across all of these players is that they are trying to take a technology centric approach to solving some of the problems that the health systems are facing today, or probably a BPAS kind of a model. And they are trying to bring down, so probably what's working well is trying to bring down the actual cost, the actual administrative efficiencies, and leading to 20 to 40% savings for your health systems, which is a which is huge saving in the current demand environment. Also, one thing which is particularly important in the RCM market is that we've not seen instances where technology is working, or we've seen very few instances where technology is working on its own without, say, an operations component to it. So probably that technology plus operations is the most widely used approach, and where it is also something that is very crucial in the hospital system environment because of the entire touch that you so there are still claims that would still require somebody to actually sit and identify, because of them being very complex, or some kind of a patient pay estimation wherein you might need some kind of a human intervention. So we are not saying that technology is going to replace all of it completely, but what it would do it is streamline, optimize, and bring down the costs around a lot of these processes, wherein the manual intervention can be kept for the most different kind of, or the very different kind of cases, and the intervention is going to really reduce from what we need from an operation standpoint.
Absolutely. Absolutely, Priya. And so, looking at the names of some of these vendors, uh, it reminds me of the journey which, one of the most well-known companies when it comes to EHR and RCM is Epic, right? And it's a trivial question for you as well as the attendees of this LinkedIn Live. So, Priya, do you know when was the first uh, Epic EMR launched in the industry? Take a guess.
um Probably 2008, 2010.
So the first EMR, Priya, and audience, please, if you have the insight on this one, please share your thoughts. So so Priya, the first desktop-oriented EMR or Windows-oriented EMR that Epic launched was in 1992. It was called Epic Cure. It had at that time very basic functionality, right? But now, if you look at the exponential growth that Epic has achieved in the last 15 to 20 years, right? That really showed that if the technology is relevant in the revenue cycle management industry, if it's relevant for health systems, sooner or later it's going to pick up, right? And we talked about a few examples, right? So on the front end, you have pre-authorization, you have patient pay estimation, you have requirement for self-service portals. Now these are big pain point for health systems, and if you are a service provider in the industry which can offer a technology plus solution, when I say solution I mean a product bundled offering for the market, then that's a winner, right? uh, Similarly, when it comes to the middle office, right, a lot of conversation that we are having revolve around automation solutions for coding, right? Automation solutions for clinical documentation improvement, right? So if you have solutions around that, and if you can offer it as bundled technology plus services, then that's a winner in the industry. Similarly, denials management, that's a very good example of an issue in the industry where a lot of health systems are losing billions of dollars because of denials, right? So solutions around identifying the reasons for the denials using analytics, right? And then proactively working towards solving that. That's again an area, a solution, or a technology as we calling it, which has tremendous potential for growth in the industry, right? So, so Priya, as we are ending this discussion, could you also talk about maybe some of the upcoming research pieces that Everest Group is planning to publish in revenue cycle management in the upcoming months, and how different stakeholders in the industry could benefit from that?
Sure. So, I'll start with the RCM platforms assessment that we are just about to publish in 2 to 3 months. So, as I was saying earlier, what we see observed is that there is a lot of technology adoption happening in the ecosystem, but that technology is not being adopted without an operations or a services component. And hence, in this platform assessment, it will give a good idea to the buy side customers to understand the different vendors that we see in the ecosystem from a technology perspective, and also understand their not just their technology play, but how are they bringing an end-to-end solution in a particular space to the market by coupling it with the operations component to it. What would be interesting for some of the health systems who are still not exploring technology is to see what kind of efficiencies these solutions or this technology is able to leverage. And that's probably something that will help some of these vendors to, become more comfortable in adopting some of this. We are also publishing an operations peak matrix report very shortly. We've already published it late last week. The emphasis of which is more around understanding the larger vendor ecosystem who are taking an operations first approach, But what's also, interesting here is that most of these vendors who are even taking an operations first approach are now bringing in some kind of automation and analytics, as they want to bring in more efficiencies in the ecosystem. And having a look at these vendors who are operating, taking an operations first approach, but are mostly operating either across the value chain or in specific areas, it will again help as a prioritization tool to the buy side customers to choose their vendors. And as a part of the conversation, we are also providing the complementary abstract uh, of the RCM operations peak matrix assessment, which will give an overall view of the different vendors that exist in the ecosystem, and the approach that they are taking into this market.
So thank you, Priya, for sharing these details. I think with that, now we are moving towards the end of the discussion. As we highlighted initially, so if you have any questions, if you want a follow-up discussion on the adoption of technology in revenue cycle management, feel free to reach out to Priya or myself. We'll be happy to get on a call and do that discussion. Thank you for taking out time and joining us on this LinkedIn Live today. Have a great day.
Have a great day, everyone.